Hey guys, nice to meet you. My name is hydrochlorothiazide. I am also known as microzide, hydrofrill, and orotec, but you guys can just call me HCTZ. Now, you may be wondering who I am, what I do, and why I'm dressed as a fire hydrant. Well, don't you worry, I will explain my whole life journey. Now, let me tell you about my job. Basically, I make people pee to fight the bad guys, but more on that later. I know that sounds kind of gross, but trust me, it's really exciting and helpful. I do this by blocking the reabsorption of sodium and chloride in the early segment of the distal convoluted tubule. Wherever sodium goes, water follows. Retention of sodium and chloride and the nephron causes water to be retained as well, thereby producing increased urine flow. That's why I'm a fire hydrant. Usually, I'm taken by mouth as a small tablet in dosages between 12.5 milligrams and 50 milligrams, once or twice daily, all depending on what your doctor told you. This is what I look like in pill form. You will start to feel me tickle your bladder after 2 hours, and then really feel the urge to pee 4 to 6 hours afterwards. I usually last in your system for about 6 to 12 hours. Now that you know how I make you pee, you might be wondering why. There are a gang of bad diseases I fight. So, superhero HCTZ is here to save the day. Some of these bad guys include essential hypertension, edema, and diabetes insipidus. Essential hypertension is a silent killer and decides to ruin people's lives for no known reason. It's unknown what causes it or where it comes from, but have no fear. I am usually the first line choice drug to fight against essential hypertension. How do I do this? By making people pee. I also help reduce blood volume and arterial resistance to create long-term antihypertensive effects. The next bad guy I fight is edema. This is another horrible disease that is caused by heart failure that leads to a buildup of fluids, especially in the legs. So, I just help people pee all the excess fluid away. Lastly, I have a sort of paradoxical effect on nephrogenic diabetes insipidus. That disease usually causes people to pee too much, but when I am given, I can reduce their urine production by 30 to 50%. How this happens is not completely clear, but I am glad that I can still save the day. As amazing as I am, I may still create some blunders here and there. Some of the side effects I can cause are thirst, muscle weakness, constipation, blurred vision, dizziness, and photosensitivity. Some of the adverse effects I can cause are hypokalemia, hyponatremia, hypochloremia, dehydration, hyperglycemia, and hyperuricemia. So if you are a nurse taking care of a patient that I'm trying to save, you should know these following nursing implications. Do not administer me late in the day to prevent nocturia. Do not give me to patients with sulfa allergies. Monitor electrolyte CMP, especially potassium. Monitor blood pressure. Monitor blood glucose. And monitor plasma levels of uric acid. Be sure to check daily weights. And be extra careful when I'm given to patients with other medications such as digoxin, lithium, and NSAIDs. I can cause digoxin toxicity, lithium toxicity, and says blunt my super important effects. So people taking me should know I can decrease your potassium levels. So consume potassium-rich foods like bananas, citrus fruit, and talk to your provider about using a potassium supplement. I can make you feel very dizzy when you switch from lying to standing to sitting. So change positions slowly. Avoid licorice root because it can increase potassium excretion. Don't spend too much time in the sunbathing. I can make your skin very sensitive to sunlight. And be sure to call your provider if you get any of these symptoms, such as muscle weakness, tremor, twitching, and dysrhythmias, as I can increase excretion of magnesium and magnesium deficiency. Also, to the expecting mothers, congratulations! But I'm sad to say I can't be on your wonderful journey with you. I am a Category B drug, and I can cross the placenta and enter breast milk. So I'm not a safe drug to look over your little peanut. Well, that's all, folks.